Health New Zealand wants to cut 4 chief medical officer roles. This is first published, I should say, on RNZ. Health New Zealand wants to reduce the number of chief medical officers from 18 to 14. So that's 4 out of 18. So that's what, 20%? 20% of them, whilst also promising not to cut frontline medical roles. The Senior Doctors Union say this will lead to a reduction in critical clinical leadership roles overseeing safe patient care in hospitals around the country. The proposal is to cut the 4 roles by integrating the small health regions of South Canterbury, Wairarapa, the West Coast and Whanganui into neighbouring larger ones and merging the Lakes and Bay of Plenty regions leadership. The Association of Salaried Medical Specialists, ASMS Union, says some chief medical officers' jobs would grow in size while others would disappear. Thank you for being with us, Gary, to decipher all the Latin that I just read that we don't understand. Can you just explain to us, first of all, what is a chief medical officer, a CMO?
A chief medical officer is typically a very senior and well-respected doctor at the hospital who gets put in a position to supervise all of the medical education of the young doctors in training and the senior doctors to handle patient complaints. So when something goes wrong, they're often a first stop in terms of investigating and disciplining and ensuring quality of the medical services at a hospital. And a chief medical officer, I mean, you could think of them almost as like a general of a platoon or something like that, a leader.
Okay.
And to not have one is, to my mind, wild. I've never worked at a hospital that didn't have a CMO. They're an integral part of clinical leadership. And for any government that talks about clinical leadership, like it's good to have clinicians in leadership roles, like that means the CMO. And to can that position at 4 hospitals it's very inconsistent with the message of encouraging clinical leadership. It's sort of the opposite of what you'd want to do.
So it sounds like you're saying it's essential to have one per hospital. Like if they brought 2 hospitals together under one branch, maybe an hour apart, but in a similar region, and there was only one in one hospital, that sounds like that's what they're talking about, integrating the small health regions. That would be not as effective. They couldn't operate that way.
Well, every staff has its own unique challenges, right? Every mix of doctors, every patient population, every community will have limitations and problems and run into all sorts of emergencies, outbreaks, you name it. And the CMO is the front person for facing up to all of that and to dealing with it. They're a really essential representative of patient needs and staff concerns at a hospital, and a conduit to upper management and like the politicians that you're talking about. And so to get rid of that very important role is pretty dangerous in my opinion.
Another line from this article, Health New Zealand pledges on Tuesday not to cut. I'll do that again. Health New Zealand pledged on Tuesday not to cut frontline medical roles amid the reset. Would you say a CMO is a frontline medical role?
Yes, I definitely would say CMO is a frontline medical role. Some of them actually are doing clinical work, heading up departments as well. Others aren't. But the point is, when there is a clinical emergency at a hospital, like let's say there's an unexpected death or something gravely wrong, the CMO is like leaps into the fray. Like they're the leadership for the doctors. And of course, there's a chief nursing officer that I believe they're also getting rid of at these hospitals. So you just have to ask yourself, if you're getting rid of the most respected doctor and nurse in a leadership role at a hospital, like what on earth are you doing? It boggles the mind.
It does sound like quite a unique position. Like they're sort of the captain of the doctors, but also they're there to help and represent the patients as well on some level.
Yeah, so I mean, I can't speak for every hospital, but like at our hospital, they're beloved. They've been a clinician and a head of a department and a seminal member of the medical staff for decades. And
Right.
they bring an amazing perspective. When something goes badly wrong at a hospital, you trust that doctor to be there. And what I'm afraid of is if you have a hospital that chooses to, or a system that chooses to get rid of that person and obviously not replace it, uh, what what sort of safeguards and safety do you have if you're getting rid of that most respected of clinical leaders?